Welcome to the Deep Dive. Today, we're plunging into the world of healthcare, guided by a stack of sources that connect some really fascinating dots.
Mm.
We've got pieces covering global quality standards, the nitty-gritty of how hospitals get built and run, and critically, the essential role you play when it comes to your own health information, particularly diagnostic tests.
Yeah, it sounds like a broad sweep.
It is. Think international accreditation bodies,
Mm.
hospital management consultants, a blog exploring clinical and operational topics, and some detailed guides on understanding common blood and urine tests.
Okay.
So what we're trying to do is connect these layers, from the big picture systems right down to your personal health journey,
Right.
to give you a clearer picture of what makes for quality healthcare and, well, how you can navigate it.
It's a journey, like you said, moving from those foundational frameworks, quality and safety,
Yeah.
through the complex engine of healthcare infrastructure, the operations,
Yeah.
right down to that crucial point of interaction you have with the system. It's about understanding the whole landscape and specifically where you fit in as, well, an informed participant.
So let's start at that highest level then. When our sources talk about healthcare quality on a global stage, one name keeps popping up. Joint Commission International, JCI.
That's right. JCI is really seen as a benchmark for healthcare quality, patient safety worldwide.
Okay.
The material highlights their reach,
Yeah.
operating in over 70 countries, across Asia, Europe, the Middle East, Africa, Latin America.
Wow.
Yeah, they've accredited and certified more than 1,000 programs, supported by like 600 experts.
That's significant. And their mission.
It's pretty ambitious, as stated, to enable and affirm the highest standards of healthcare quality and patient safety for everyone.
And what does that accreditation process actually do for a hospital? It sounds intense. The sources share some direct perspectives from hospital leaders.
They really do. And they underscore it's more than just, getting a badge. It's transformative.
How so?
Well, Alex Land, for instance, from Hong Kong Adventist Hospitals, he described the JCI process itself as one of the best team-building exercises they'd ever done.
Interesting. Team building.
Yeah, saying it significantly enhances coordination, communication across different departments.
Okay, that makes sense. That high-stakes coordination is absolutely vital in a hospital setting.
Exactly. And then Shiji Kurian, a senior quality officer at Burjil Fora Hospital, gives them a competitive edge, strengthens community confidence.
Right.
But crucially, they mention how it improved risk management and reduction, really organizes and strengthens patient safety efforts.
Fostering that culture focused on safety.
Precisely.
Okay. Any other perspectives?
Yeah, Imad M. Sadek from Emirates Hospitals Group notes that the JCI Gold Seal of Approval adds significant value, boosts patient confidence even further. And Roxana Fulton at Corniche Hospital echoed this. Achieving their 6th accreditation, she said, demonstrated a continuous, embedded commitment to excellence and sticking to those international standards.
So it sounds like hospitals aren't just getting a certificate. They're fundamentally changing kind of how they operate and think about safety.
That seems to be the takeaway, yeah.
What are some of the concrete tools JCI provides to help them do that, to achieve this transformation?
Well, they offer those rigorous international standards we mentioned,
Yeah.
including specific international patient safety goals.
Okay.
These are designed to tackle common high-risk areas. They have accreditation programs tailored for different facilities, hospitals, academic medical centers,
Right.
and certifications for specific things like clinical care, healthcare sustainability, even telehealth services, which is obviously growing.
Yeah, very relevant now.
And beyond the standards, they offer advisory services, education resources, all with this stated vision aiming for, well, zero harm and highly reliable care.
Zero harm. That's a powerful goal.
It really is.
Now, building on that idea of setting standards, the sources also bring up a national equivalent in India, the National Accreditation Board for Hospitals and Healthcare Providers, NABH.
Yes, NABH. It serves a similar purpose, but, at a national level within India. It's part of the Quality Council of India.
Okay.
And it's specifically tasked with establishing and operating accreditation programs for healthcare organizations there, setting benchmarks for the local health industry.
Got it. Supported by stakeholders, but independent.
That's what the material emphasizes, yes. Supported by industry, consumers, government, but maintaining functional autonomy.
Okay, so we have these frameworks, global and national, defining the bar for quality and safety. But actually, Building and managing a facility that meets these standards, that's a huge job.
Oh, absolutely massive.
And this is where consultancies like Supreme Medic come into the picture, according to our sources.
Exactly. Supreme Medic Consultancy Private Limited is highlighted as a key partner for hospital owners, supporting them through, well, basically the entire life cycle,
The whole thing, from the start.
from initial planning all the way through to achieving accreditations like NABH.
That sounds incredibly comprehensive. Walk us through some of their services. It gives a real sense of the complexity involved, I think.
It really does. Their services cover everything. The foundational steps like, planning and designing the hospitals.
Right, the blueprint.
Exactly. Then expert support for NABH accreditation.
Yeah.
And also NABL implementation and accreditation. That's the standard for the labs themselves, making sure their testing is accurate.
Ah, okay. Important distinction for the labs.
Very. And then the crucial task of recruitment, finding the right doctors and nurses.
People are key.
Absolutely. They help implement quality management systems, those documented processes, for consistent high-quality operations.
So the blueprints, the processes, the people, what about the kind of physical structure and the day-to-day flow?
That falls under their infrastructure services.
Mm.
Things like constructing specialized areas, modular operation theaters, installing medical gas pipeline systems, procuring all the necessary medical equipment and furniture.
What?
And then on the operational side, under healthcare business consulting, they cover hospital operation management.
Which involves?
Oh, everything. Preparing standard operating procedures, SOPs, those step-by-step guides for every task.
Right.
Analyzing how efficiently departments are using their capacity. Restructuring departments if needed. Setting up and managing the medical records department.
MRD, right.
Yeah. And implementing and maintaining the hospital information systems, the HIS. That's the digital backbone, patient data, appointments, billing, all that.
Wow, it really is soup to nuts, as they say. And the sources even mention they partner with investors, like equity stakes.
Yes, they collaborate with investors on strategy, execution for healthcare ventures, and the material notes they might even take equity as their fee. So, yeah, indicates a pretty deep partnership model.
Okay, so here's where it gets really interesting, I think. Looking at the breadth of topics mentioned in sources like the Hosty Match blog, possibly linked to brands like Supreme Medic, it just drives home how many different complex plates a hospital has to keep spinning.
Absolutely.
To maintain those quality standards we talked about, we see everything from healthcare financing, chronic disease management, to patient care trends, specialized senior care, a whole range of therapy services, speech, occupational, physical therapy.
It's vast.
And they even delve into specific medical imaging tech used in India, mentioning X-rays, MRI, CT, ultrasound, PT, CT scans.
And that huge list of operational and clinical areas.
Yeah.
It isn't just a list of services. It highlights the immense interconnected expertise needed behind the scenes
Right.
to deliver healthcare that actually meets those rigorous standards like JCI or NABH. Every single one of those areas needs processes, skilled staff, management oversight. It's incredibly complex.
Okay, so we've zoomed out to the global and national standards, looked at the incredibly complex operational side of building and running facilities, aiming for those standards. Now let's bring it back to you, the listener, because much of your personal interaction with this whole complex system happens right at the point of diagnostic testing.
Exactly. Blood and urine tests. The sources present them as among the most frequently ordered investigations by doctors, particularly in the context discussed. They're fundamental tools.
Why are they so essential? What information do they actually give doctors?
Well, the sources explain they're used to detect or monitor just a huge range of things.
Yeah.
Infections, how well organs like your kidney, liver, or heart are functioning.
Okay.
Whether you have nutritional deficiencies, hormonal imbalances, think thyroid issues,
Right.
conditions like diabetes or high cholesterol, issues like anemia. They can also provide really crucial clues pointing towards more serious conditions: cancer, autoimmune diseases, chronic illnesses.
So they act like vital pieces of a puzzle, helping doctors see what's going on inside your body.
And this is a key point the sources really emphasize. These tests are tools. They provide data.
Right. Not the whole answer.
Exactly. They don't typically diagnose conditions in isolation. They guide the doctor towards the correct diagnosis by giving them vital information to interpret alongside your symptoms, your medical history.
And this is precisely where being an active participant becomes so essential.
Yes.
It's not just passively submitting to a test, it's engaging with the process. And that journey starts even before you give a sample, right? By asking informed questions.
Absolutely. The sources offer a really strategic list of questions every patient should think about asking before their test. First up, just cut to the chase. Why is this test being advised for me?
Yeah, the why.
What specifically are we trying to find or rule out based on my symptoms or history? Is this routine or is it linked to something specific I'm feeling?
Understanding the why definitely empowers you. What about preparation? That seems critical for getting accurate results.
Oh, it's vital, and often where mistakes can happen. So ask,
Yeah.
do I need to fast or prepare in any certain way?
Like fasting for blood sugar tests.
Exactly. That's non-negotiable for tests like fasting blood sugar, lipid profile, glucose tolerance tests. Usually 8-12 hours without food. Always confirm if water's okay. Generally it is. And this is a point the sources really stress. You must ask if you need to stop any medications or supplements you're taking.
Oh, that's a big one.
Huge. They give examples like aspirin, vitamin D, iron trial. These can directly interfere with specific markers the lab is measuring or alter levels the test is designed to read. You have to inform your doctor about everything you take.
That detail about meds and supplements is so easily missed. And thinking about quality standards again, where you get the test done, links back to those accreditation bodies we talked about earlier, right? Like NABL.
It does. So a practical question is, where should I get this test done? Is a lab at a government hospital okay? Or should I look for a NABL-accredited private lab?
Right.
And asking about potential discounts, packages, or senior citizen benefits is also just smart navigation of the system.
Makes sense. And the practicalities of the procedure itself, like how long will it take?
Yeah, ask, how long will the test take and where exactly will it be performed? Also, it's wise to ask, are there any risks or potential side effects I should know about?
Usually safe, but good to know.
Right. Most common tests are very safe, but things like minor bruising or pain from a blood draw are possible. Urine tests are typically non-invasive, though a 24-hour collection has its own, inconveniences.
And of course, the cost question. Can't forget that.
Crucially important, will this test be covered by my insurance? What is the estimated cost? Are there any less expensive options available? Always try to get an upfront estimate so there are no surprises later.
Good advice. Now, for urine tests specifically, the collection process itself seems to have some key details for accuracy.
Yes, definitely ask, how should I collect my urine sample correctly? The sources advise that the first morning sample is often preferred. You absolutely need a clean, sterile container.
Okay.
And you should cleanse the area properly before collection. Ideally, the sample should get to the lab within about an hour.
Timing matters.
It can, yeah. And for women, it's important to let the doctor or lab know if you're menstruating, as that can affect results. And clarify if they need a midstream sample or if it's one of those 24-hour collections.
Got it. Finally, planning for what happens after the test.
Yes. Ask what happens next. This means getting a clear timeline for when the results will be ready, how you'll receive them, phone call, portal, paper.
Right.
When and where should your follow-up appointment be? And does the doctor anticipate needing any additional tests based on these initial results?
Asking these questions before the test really does transform you, doesn't it? From someone just following instructions to an informed partner.
Absolutely. You're not just, giving a sample. You're actively understanding the why and the how of the whole process.
Okay, so you've done the prep, taken the test, and now you have the report. Maybe it's online, maybe it's on paper. What happens after you receive the results? The sources are really clear. This is another critical point for active participation.
It really is. Getting the report is only half the battle. Understanding what those numbers and terms actually mean for you is the key part.
So you have to discuss it with your doctor.
You absolutely must. The most fundamental question is, are my results within the normal range? If they're not, what does that mean for my health?
Don't just rely on the printout's reference range.
Exactly. Don't just compare your number to the range on the paper. Ask your doctor to interpret the results in the context of your age, any existing conditions you have, any medications you're taking. Make sure you understand what the normal reference ranges for the values measured actually are.
So don't just look at the red flags or lack thereof and panic or relax prematurely.
Precisely. Then ask, based on these results, do I need to repeat the test or have it confirmed? Sometimes results that are maybe borderline safe for blood sugar or thyroid levels might warrant a retest just to confirm.
Okay, that makes sense. And the question that's probably top of mind for most patients, should I be worried about these results? Do I need treatment?
Yeah, it's easy to jump to conclusions if a value is slightly outside the normal range. Ask your doctor if this specific deviation is actually significant for your situation. And what are the recommended next steps? Could it just be lifestyle changes? Or is medical treatment actually necessary?
And dig deeper, too.
Yeah, ask. What could abnormal results indicate? And are there other factors, maybe not related to illness, that might have influenced them? Like maybe issues with preparation or recent activity?
Connecting the dots to specific organs also seems vital for understanding.
Yes, definitely ask. Do these results suggest any potential problems with specific organs, like my kidneys or my liver?
Okay. And for urine tests, if the results show something unexpected, like blood.
Right. If you have abnormal findings in a urine test, specifically ask, what exactly do these abnormal results mean? This could relate to things like blood, protein, or other substances that shouldn't normally be there.
And if blood is detected,
Then a critical question is, what might be causing the blood in my urine, and what specific tests are needed now to find the root cause? And finally, always try to integrate the results into your overall health management. How can I best manage my other existing health issues in light of these test outcomes? Your doctor needs to help you see how this new piece of information fits into your broader health picture.
that detailed list of questions really does empower the patient after the test results come in. Beyond asking specific questions, are there some general tips the sources offer for just being a smarter participant in diagnostic testing overall?
Yes, there are some really practical takeaways mentioned. First and foremost, keep a copy of every single test report you receive.
Simple but important.
Yeah, and make sure it includes the date and the name of the lab that did the test.
That seems like such a basic thing, but probably powerful for tracking your history over time.
It is, because the next tip is directly related. Track trends over time. If you're monitoring a chronic condition like diabetes or cholesterol, seeing how your numbers change over months or years provides much more insight than just looking at isolated results.
Right, one snapshot isn't the whole story.
Exactly. Using an app or a digital health locker, like the Ayushman Bharat Digital Health ID mentioned in one source, can be incredibly helpful for organizing and accessing this history easily.
Having that historical data right at your fingertips must make discussions with your doctor much more productive.
Definitely. And practically speaking, especially where cost is a concern, the sources suggest you should always feel comfortable asking your doctor if a test can perhaps be avoided or maybe delayed.
It's a valid conversation.
Absolutely. It's about necessity versus expense sometimes.
What about the flip side? What behaviors should patients explicitly avoid when it comes to testing? Any don'ts?
Yes, the sources offer some clear warnings there too. First, don't assume that normal results mean there's absolutely no problem.
Ah, good point.
Always discuss any persistent symptoms with your doctor. Sometimes further testing or different kinds of investigation might still be needed, even with normal basic results.
Okay.
And absolutely, do not Google your abnormal results and try to self-diagnose.
Oh, the dreaded Dr. Google.
Exactly. The internet lacks your personal context, your history, your other symptoms. Share your reports with your doctor for their expert interpretation. That's crucial.
So resist that urge.
Please do.
Yeah.
Also, don't order random tests for yourself out of anxiety or fear based on things you might read online. Let your doctor recommend the tests that are most appropriate and useful based on your specific situation.
That online self-diagnosis rabbit hole can be terrifying and, frankly, deeply misleading.
It really can be.
Yeah.
And finally, perhaps most importantly, don't skip the post-test discussion with your doctor.
The follow-up.
Yes. Simply receiving the report isn't enough. You need that follow-up appointment or call to truly understand what the results mean for you and to determine the necessary next steps together.
It all circles back to that core idea presented throughout the sources, doesn't it? Being an active participant.
It really does. The final sentiment from one of the sources sums it up perfectly. Blood and urine tests are powerful tools meant for better care and better outcomes. Your role is to be an active participant, not just a passive recipient of testing.
Right.
As they put it, don't just give a sample. Ask why. Understand. Follow through.
So we've really journeyed across the landscape today. From those international frameworks, setting the highest bars for quality and safety, through the consulting partners who help build and manage the incredibly complex operations of hospitals striving to meet those standards.
Yeah, the whole engine room.
All the way down to the absolutely crucial role you play as a patient. Just by being informed and asking the right questions about your own diagnostic test, it's crystal clear that high-quality healthcare isn't just delivered by institutions, it's a dynamic partnership.
Precisely. When you understand the complexity that goes into building and running facilities aiming for, say, JCI or NABH standards, and you combine that knowledge with taking informed action about your own personal health data, like your test results.
Yeah.
You're not just a passive patient anymore. You're contributing directly to the effectiveness and the quality of your own care and, influencing the system around you in a small way.
This whole journey, it raises a really compelling question, I think. If so much effort and expertise are poured into setting these systemic quality standards and managing the whole infrastructure of care,
Right, all that complex machinery.
how does your informed engagement, understanding those test results, asking those questions become that vital final link? The piece that transforms a good healthcare system into truly great patient-centered care.
That's a fantastic question to ponder.
Something powerful to consider anyway as you navigate your own health journey and interact with the system.